issue of building out and expanding the mental health care workforce is a crucially important issue. I hear about this all the time. People who finally kind of break through the stigma and the systemic challenges to say, okay, yes, I'm ready to get help, and then they face long waiting lists, wait times that sometimes in Minnesota will reach to months. And of course, we would never put up with that kind of waiting time if somebody was having a heart attack or had a broken limb. And so I think addressing this workforce shortage, which is often the cause of this waiting challenge, is really important. Let me just ask Ms. Johnson a follow-up question. I mean, I get from what you were saying that these loan repayment programs work to build out the mental health care workforce across the broad spectrum of providers, because it's not just psychiatrists, it could be a whole, across the whole range of providers. Is that right?
That's correct. There are a whole range of mental health professionals who are eligible to participate in the National Health Service Corps. We also have a Nurse Corps loan repayment program. And the advantage of these programs is that not only are we helping those individuals with loan repayment in return for service in underserved communities, but our data consistently shows that people tend to stay in the communities in which they originally practiced. And so it is a long-term investment in those communities.
Now, another issue that I hear about all the time is that we have loan repayment programs that are getting folks into, that are getting people ready to go into training, but then we have a shortage of trainers. We have a shortage of educators. This is a challenge in Minnesota around nurses, not only in mental health training programs, but more broadly. So could you just talk about what we need to do to address that challenge of educators in the field?
I just really appreciate you raising the question, Senator, because before the pandemic, nurse faculty was a challenge. The critical issues that our heroic frontline nurses have dealt with throughout the pandemic has made it even harder for us to recruit individuals who have the time and resources and capacity to function in nurse faculty roles. We have a loan repayment program to encourage people into nurse faculty. We'd love to continue to grow and expand that work, but we also are, in my role at HRSA, I am increasingly reaching out to health professions leaders and health systems leaders who have a shared interest in ensuring that we have a viable nursing workforce for the future, because I think this is, as Ranking Member Burr pointed to earlier, a place for public-private partnership to encourage individuals to work in nurse faculty is an important partnership.
Because you might have been a practitioner, the thing you would like to see is practitioners who then come into training and become an instructor, but often that requires, people are going to be hard-pressed to do that if they're taking a salary cut.
That's right. I mean, what we can offer is the loan repayment for you to be able to do the educational piece, but given the current dynamics of where the workforce is, it is a challenge on the salary side.
So I think there's more work that we should think about doing together on this, because if we are, I see in Minnesota pumping lots of resources, good resources, into loan repayment and scholarships, but then there aren't any spots because of this issue that we're talking about.
I would welcome the opportunity to work with you on this. This is a huge priority for us as well.
That's fantastic. Mm-hmm. That's great. Dr. Delphine Rittman, I'd like to ask you, take a bit of time to talk about this question of how we integrate behavioral health care better into primary care settings. We know that this is a powerful way to expand our national mental health treatment and behavioral substance abuse treatment capacity. And this strategy, of course, recognizes that it's health. It's not mental health separate from physical health. And the better we integrate, the more we're going to undo the barriers that we have up there to block access to mental health care. So in just the few seconds I have left, can you just talk a little bit about some of the models that are out there for doing this kind of integration and where you see the greatest opportunity?
Yes, and thank you for that question. So absolutely, this is an area that is one of the SAMHSA priorities as well. We have an initiative called PBHCI, Primary Care Behavioral Health Integration. That is a grant program that essentially integrates behavioral health screening into primary care settings. We know that's so important because often individuals will go to a primary care setting first before they'll contact or connect with a behavioral health provider. So if screenings can be done in that setting, it allows for the individual to be connected to appropriate services and supports. We also have the CCBHC model, which integrates behavioral health or primary care integration into behavioral health settings. So certified community behavioral health clinics provides that integration as well, which is critical.
Madam Chair, I know there's lots of interest in this topic. On the committee, I'm working with Senator Moran, amongst others, to try to figure out how to support this, and I want to just thank the Biden administration. I know that both of these issues I've raised are part of their broad national strategy to address these challenges, so appreciate it very much.
Thank you. Senator Cassidy, and Senator Cassidy, just let me say to you, we're all thinking of you and all the people